Jemma and I'm from Manchester. For my elective I went to Canada and chose Toronto specifically. Factors that influenced my choice was purely country. Canada, I'd been there before and I really enjoyed it when I'd been there. I also had some family over there, so I felt a bit more comforted by going there because I was going alone. And yeah, that was it. Hospital-wise and specialty, I knew I wanted to go to a children's hospital, and they had one there in Toronto. So yeah, those were my main reasons and factors that influenced it really. It took me, I'd say, about 6 months or so to plan my trip. Just because obviously things take an awfully long time, and then things crop up that you don't think of when you're planning it really. I did use the elective that worked for planning my elective. There was also some little checklists that I'd made and found through, I think it was the BMJ articles as well, that I'd found them. So they were really useful, just being able to see things and tick them off. And also lots of invaluable help from my mum. Organising my travel and accommodation was done mainly through the hospital, so I asked them what would be best, and they just advised where I should stay and which companies I should go through, and then it was up to me to sort that out. So I ended up staying at the University of Toronto, which was quite nearby. The university did help us with our elective planning. They gave us a series of lectures with regard to what sort of treatment we'd need to do, like risk assessments, things we'd need to look out for and prepare for before going to our elective destinations. I'd definitely recommend starting early. It just saves you a whole lot of stress and panic later on. And actually, I suppose having, if they've got a particular specialist interest, or even a particular country that they'd really like to go to, that's always a good starting point to go from. My elective was funded by the bank of mum and dad. They were very, very helpful with that. I had to look for bursaries and things, but there's nothing really related to what I was doing in orthopaedics. So amazing. I think you'd be hard pressed to find other students that would say different, but it was really fabulous, really good eye opener, and I think more so for myself, because I've never done anything like this, especially alone as well. I think I came into my own really, and have developed as a person. Everything, the experience in clinics and theatre, just even on my weekends off, just touring around and having a look around, speaking to people. So I was in theatre, and the surgeon was there, and I scrubbed up, and he's like, oh, we'll let the student make the first incision. The colour just drains out your face. You're like, oh, they're gonna let me do what? So there we were. Everything was nice and quiet in the theatre, and I was handed the scalpel, and I was like, this is only a child, because I was doing paediatric orthopaedics. I think this child must have been about a year old, and I was like, I can't believe I'm doing this, but I did it anyway. And after you've done it, it's a bit like coming off a roller coaster ride, where you just feel so elated after you've done it. But yeah, I was allowed to do that and just assist in the surgery after that. The doctor's expectations of me were fair. It was pretty similar to a teaching hospital over here, so when I explained that I was a medical student, the first couple of weeks they let me observe, and then after that they let me have a bit more hands-on experience. But I was never put in that position where I was out of my depth, and I was always guided and assisted and taught what to do. There was never any particular point where I felt vulnerable, because I was always with someone, and they'd always warned me beforehand if there was going to be anything like that. And so yeah, I was just like a little apprentice really. The healthcare provision in Canada is, well, it's not the same as what we have here. Actually at the time whilst we were over there, there was quite a lot of debate in the news about the turmoil that was going on with the healthcare system, because obviously with the current economic climate and stuff, there was many doctors, even the doctors that I were with, you know, bringing to light that actually the Canadian healthcare system really isn't sustainable. You know, it may last for a few more years, but if they carry on the way they are, because it's like part private, part publicly funded, and the healthcare is good, like patients get what they need, but it involves an excessive amount of spending that Canada can't really keep up if they want to provide the same level of care. Yeah, I feel I coped quite well once I was there. The first few weeks were a bit scary because I went alone, so it would have been nice to have someone else there, but I coped well, just chatted and made lots of new friends. Looking back on it, the elective was far better than what I'd anticipated. When I thought I was going to be, you know, I was scared. I just didn't think I'd be able to do what they wanted. I thought I might get lost, you know, things like that. And coming back, I feel like I've come back a whole new person. Thoroughly enjoyed myself, and it's exceeded my expectations. The whole experience has affirmed my career aspirations, really. I've wanted to do paediatric orthopaedics, and having the chance to do it for 5 weeks in a very specialist centre has just confirmed that that's what I really want to do. The whole experience was definitely beneficial professionally. Not only have I gained experience and, you know, confirmed that that's what I want to specialise in eventually, I've also made contacts and, you know, built really good relationships with the doctors out there, so the aim is to go back in a few years, maybe to do a fellowship. I would definitely recommend Canada as a potential elective destination for anyone. It's so big, it's so varied, and there's plenty of opportunity. If I could do my elective again, I would probably go into different departments of the paediatric hospital, because it's something that interests me, and because it's such a specialist hospital, it's like a tertiary centre. You know, I imagine they'd be doing even more amazing things in like the cardiology department or even the renal department and things like that. So I'd probably go back and have a look at a different specialty. Jemma's top tip for students would definitely be to plan early, and if you have just an inkling of like an interest in a specialty or an area, go with it and, you know, find out a bit more, like explore it, and I'm pretty sure they'll be, you know, blown away by their experience. How did I feel about winning the prize? I felt over the moon. I was in shock, really. I thought it was a bit, you know, at first you think, oh, really? Like, is someone winding me up? But no, when it settled in, I was just over the moon. Plans for the money? I don't know. I think I might put it aside maybe for another trip to Canada. I think that would be good. It's something that I want to do after coming back from my elective, so it can go towards a little fund.